I'm Dr. Sarah Ann Munoz. I'm a researcher based at the University of the Highlands and Islands, and I'm a health geographer. We set out to see how we could encourage people to make better use of hospital grounds for health and wellbeing benefit.
Because we wanted the healthcare and the environment sectors to work more closely together in Scotland. And really that's to try and use the green assets that we have around our healthcare facilities for health and for wellbeing.
Each of the partners in the project brought a different area of expertise. The University of Highlands and Islands brought our experience in community engagement, involving stakeholders in decision-making processes. The NHS and Forestry Commission brought different perspectives on how we could use the hospital grounds.
And the main objective was really to try and engage local people, staff from the hospital and patient groups.
And we were able to work with those two partners to then actually implement health interventions in an outdoor space and to test some of the ideas from our research.
The groups of people that I worked with initially were people from cardiac rehab in the hospital, cancer care as well, also with other members of the community. The main activity was to show people around the green space here, the 70 or so hectares that we have at Forth Valley Royal Hospital.
This research is important with the rehabilitation services as it showed that the patients got a lot of benefits from building up social networks, building up confidence, improving their mood and also increasing their physical activity.
We involved these different stakeholders through a community engagement process. We developed a set of workshops and different techniques that involved these stakeholders in thinking about how they use the space and how it could potentially be improved to encourage them to use it more in the future. They were part of the creation and the interpretation of maps of the hospital grounds. It helped them understand the spaces that were available to them, and it helped them discuss the potential health benefits of actually taking part in activities within the grounds. We've developed best practice guidance for a decision-making process around healthcare outdoor spaces. The research is really applicable to different types of healthcare setting. That could be from a GP practice through to different types of hospital or even care home settings.
There's lots of opportunity to create gardens, to create views out to green space, but also to encourage people into those spaces through paths and through information and signage.
It's changed the perspective of the cardiac rehab team with regards to the green space to help increase the patient's confidence with how far that they can walk. It's given them now the insight that they can walk further and use that environment to increase their walking and also increase their sort of own physical activity in day-to-day general exercise and physical activity.
People have tended not to think about hospital grounds as a green space or as a potentially health-promoting space.
We'd always anticipated previously that the green space was there for the community and for staff as visitors, but never had we expanded it to looking at patient care interventions, and that has actually ballooned into real enthusiasm for the way forward in terms of how can we replicate this model, not just on a big hospital like Forth Valley Royal, but also in our smaller community hospitals.
In the work, we've shown that hospital grounds need to be more physically accessible, but we've also shown that they need to be more socially accessible. One of the unique things that our project has done is to apply a social return on investment framework to the health interventions that we piloted. So we've shown that there are many different benefits that can come from these type of health interventions, from improved mood, decreased stress, to physical health benefits such as joint improvement. And by applying a social return on investment framework, we've shown that about £4 worth of social value is created for each pound invested in these types of activity. The knowledge exchange element was really central.
It's really helped us to look at the evidence base from the literature and about the growing body of evidence which underpins the approach that we've taken in this project. So it gives it that strong foundation to build on, and it also brings in some rigour.
The funding from the AHRC and SFC was really crucial to bringing our partnership together.
It's given us the opportunity to build the monitoring and evaluation and the research into the work. And I think quite often that's a missing bit of the jigsaw. So being able to have the research built in from the start has made a big, big difference.
The importance of the academic research in this project has been a significant driver for change. The time frames that the academic researchers were able to work with us on drove the whole process.
Our project helps to meet the Scottish Government objective for a healthier Scotland because of the different types of group that have been part of our project, not only staff, but patients and visitors and potentially local community residents. So you have a wide variety of groups that could benefit in terms of physical health improvement, but also mental health improvement.
It humanises the experience and it really gives people a chance to connect and to recover in a different type of environment.
In the longer term, I think the materials and the tools that we've created can be used by clinicians and the environmental sector in other healthcare settings.
So I would see this as being really a showcase of how you can work in partnership, how the environment and the health sectors can work in collaboration and really join up the built environment and the natural environment.
With the help of the NHS and the Forestry Commission, we're disseminating those tools throughout Scotland, and we're starting to see interest at other types of hospital and healthcare buildings for using these things to create more health interventions and more accessible green spaces.